Dr. Vicky Cooper.
Thank you so much, and I absolutely echo what you say. Having been in the healthcare business for 20 years, it's a very familiar conversation. I wanted to go back to severe mental illness and physical health, and I wanted to ask your opinions on, obviously you've outlined that there are severe discrepancies between physical health outcomes in this particular group of people and the general population. We also know, of course, that that is true for other groups of people in our population. So I just wanted to ask the three of you what you think the specific barriers are for this particular group of people and how we might start to overcome those barriers. And I'm sure you're doing work to address that already.
So first and foremost, say that people with severe mental illness, particularly people with schizophrenia, bipolar illness, die 15 to 20 years earlier than the general population. Suicide is very, very common, but it's not the commonest cause of death. It is cardiovascular disease and respiratory disease. And that's partly, there is something about the illnesses themselves that increase the risk, we know that. There's certainly something about people's lifestyle. The medications that we give unfortunately impact in a negative way, so it compounds a problem that's already there. But one of the biggest problems is access to physical health care. So there's the QOF that Emma spoke about. So GPs are expected and incentivised to provide physical health care. Certainly, there's a national audit of psychosis, and that requires, particularly in early intervention services, to provide physical health care. And actually, that national audit's been showing improvements over time. And that's really positive. So it shows that if you are required to measure it, you'll do it. When we're not required to measure it, then people don't do it so well because we're all very, very, very busy. Mm-hmm. And one of our concerns is that in the recent planning guidance, the kind of expectations of providing physical health care have dropped off a little bit, actually. They're not really in there. It's a bit arbitrary. It depends on the ICB. That's a problem because we already know that if you've got severe mental illness, you're not going to get access to care. So if you have cancer, you've got severe mental illness, you are 50% less likely to get treated for that cancer. That's simply discrimination. Mm-hmm. And so we would argue and advocate for the most marginalised people in our society getting the best care. If we design care around the most marginalised group, everybody else will benefit.
So I think Lad is absolutely right. I mean, there was a target around physical health checks, and I used that in my ICB to haggle for additional funding. So we set up a bespoke service for all patients on our QOF SMI register. I'd love to do more, but at least they all get the annual review you've heard about and a proper physical health check, and that happens in conjunction with the GPs. I think my biggest mantra is don't just screen, intervene. So those staff have the capacity in their job plans to then support patients to access stop smoking, so they know who the local authority services are that commission stop smoking services, smoking cessation, weight management, all those things, and they have that relationship. They go into CMHTs and actually deliver health checks there for patients that really don't engage, where it's tricky to engage. So it needs to be a kind of system approach, but you do need to invest, I suppose, I think, and have quite a specific resource. And my last comment is actually parity of esteem is interesting, and having Lade sitting here, but people, we get slated for not thinking about mental health, not me because I always do, for the physical health lot, GPs and physical health consultants, but sometimes it's the other way around, and actually our consultant staff or specialist mental health staff don't always think physical health. So I think the stuff that Trish has worked on, putting a lifestyle medicine programme into inpatients and into the hospital and bringing in what's really well-being, and those 5 pillars that the RC Psych sort of devised around lifestyle and what's important has been really, really good. And we're starting to see the shift around a cultural change in the specialist mental health setting, saying, actually, we can do a blood pressure. We are a nurse. We did do that at one point. Weight management. And I'm being facetious, but, it's really important that it's both ways and that there's that whole cultural approach to physical health. So it was interesting hearing what Eve said. And we need to intervene early. 2/3. It's shocking. 2/3 of, it's cardiovascular that kills people, sadly. And 2/3 of that's preventable. And it's not good enough. And we have done some physical health guidance in NHS England, but we really need to then look at levers to get people to engage with that and roll that out. But I'm off on soapbox.
Actually, just to say it, because, Emma's right that sometimes in mental health care, practitioners don't feel confident about physical health care. But there's a very good reason for that. A good 20 years ago, there was a thing called Project 2000, Steve will know about this, And a decision was made that if you were to become a mental health nurse, you didn't need general health training. So psychiatrists, we go to medical school, we become doctors, we train in all the other parts of medicine, then we specialise in psychiatry. And the same was true for nurses. Nurses trained as general nurses, and then general physical nurses, and then specialised. That decision was made that didn't need to happen. So it meant there was a generation of nurses who weren't so confident in looking after physical health care. Psychologists don't do physical health care, social workers don't know how to do physical health care. And as their roles became more, that there was an expectation that they did more, then we're actually asking people to, it's one thing to say, taking the blood pressure, but actually if you've never been taught how to take a blood pressure, then why would you know how to take a blood pressure? Yeah. That's changing now. Yeah. But it's not simply because people were, being lazy or anything like that. It's because actually they hadn't been trained, and we recognise now that that's a problem. But there is a significant issue everywhere for people with severe mental illness, and it's a real plea. Please, could you bring back physical health monitoring into our guidance, because if it's not there, it won't get done. Yeah.
Excellent. I think that's a very worthwhile plea. Steve, is there anything you'd like to add?
Unless you're in Ardash, because we're going to have 95% of people swim with it. But I suppose to that point, so having been the class of Project 2000 in the late 90s, having 18 months of physical health training, I remember Sister Black on D17 at New Cross Hospital, who taught me how to use a sphygmometer, and I wasn't allowed to leave the shift until Sister Black was content with that. But actually I went back to do my general nurse training for that very reason. So being a community psychiatric nurse, a CPN, actually what I was really skilled at doing was completing benefits forms, to doing blood pressures, referring to the diabetes nurse, engaging with the African Caribbean Community Initiative in Wolverhampton, because I was the care navigator, because it's the reverse. You get too many handoffs when people need a physical health check, because often if it's done in QOF in GPs, the person then has to go and present to the GP, negotiate a receptionist, explain that they need a physical health check, and often they won't continue past that the person who holds all the keys to the access of the appointment at the GP surgery. And again, there's some national deviation. So in parts of Rotherham and Doncaster and South Humber, the GPs actually have allocated the QOF money to our services, so we provide that. In others, they don't, and we really enhance and support the GPs in making sure that people get physical health checks.
Great, thank you so much. I think you've outlined the issues really well and succinctly, and I suppose just going back to what Lade says, the sort of the outstanding stuff that you're doing is fantastic. It's just the lack of standardisation across the country, which I think we're hearing loud and clear, so thank you.